Good morning. Please welcome the SIU PA classes of 2022 and 2024. Good morning, everyone. I'm Don Deemer. I'm the program director for the SIU PA program. Thank you for attending our white coat ceremony on our 25th anniversary of the PA program. Thank you. I would like to welcome our distinguished guests, faculty and staff, our preceptors, our mentors, and our family and friends. Today we are here to celebrate the accomplishments and sacrifices you and your loved ones have made together. We are celebrating two groups. One is just beginning the student portion of their journey towards becoming a healthcare giver, and one who has completed the student portion and are now ready to begin their new life as a clinician. The white coat ceremony was initiated on August 20th, 1993 at Columbia University with the goals of welcoming new medical students and emphasizing the balance of scientific excellence with compassionate care. Since then, variations of the ceremony have been used by many health professions. Today's ceremony will be a celebration of the accomplishments of the class of 2022 and an initiation into clinical medicine for the class of 2024. The short white coat being received by the class of 2024 will represent the transition from didactic studies to the clinical phases of their training as they are to shortly begin mentor clinics. These students will be taking on an identity as a healer. The short coat should serve as a reminder of their commitment to learn to care for their patients competently and compassionately and their humble role as a student. The long white coat being received by the class of 2022 represents their transition from student to the graduate professional phase of their new career as they will be receiving their completion certificates today. It should serve as a symbol of their commitment to upholding their responsibility for the health, safety, welfare, and dignity of all human beings. Today, as their first responsibility as graduate PAs, the class of 2022 will be given the honor of coding the class of 2024. This act of coding will remind us that the skills we celebrate today are to be nurtured over a lifetime, and that medical skill is not a possession to be owned, but a gift to be passed on to those who follow. To begin the ceremony, I would like to introduce our keynote speaker, Dr. Jennifer Orozco. Dr. Orozco is the president of the American Academy of Physician Associates and the director of advanced practice providers at the Rush University System for Health. Jennifer is a tireless advocate for the PA profession and a special friend to all of us. Welcome, Dr. Orozco, and thanks for speaking today.
Well, thank you. Thank you, Dr. Deemer, for allowing, I got to put my old lady glasses on. There's a time in your life where you realize that you can't make it without the glasses, so. Well, congratulations, and graduates and faculty and distinguished guests. Let me first start by saying thank you. Thank you for the opportunity to be here and celebrate with you today. But I have to tell you, I almost didn't make it here. Not because I was working, and not because I didn't want to be here, but because after the pandemic, I had made a commitment to take better care of myself, my mental health, and my wellness. Well, and let's face it, Dr. Deemer made me promise about a year ago that I would come, and if I didn't show up, he might never talk to me again. But in all seriousness, you know, the pandemic and its fallout hit me hard. As a PA and a PA leader for almost 20 years, I have seen and been part of many challenging events and situations, but nothing prepared me for what I faced as Director of Advanced Practice in Chicago. As director and a leader in the hospital's command center, I had both the benefit and the burden of being on the front lines. I sent countless employees and volunteers to take care of patients with a disease we knew little about. I wasn't sure if they would get it, and I wasn't sure if they would live if they did. But they went because I asked them to. I asked young mothers just back from maternity leave to leave their newborn babies at home and take care of COVID patients, and they did. I asked students and new graduates, such as yourselves, to take care of the most critically ill COVID patients in the ICU, and they did. I asked those with elderly parents at home to work 12-hour shifts at night, weekends, and days for months on end, and they did. And they did it without argument, without fanfare, and just said, whatever you need for our patients. These past years with COVID and now the state of healthcare and the world since have been some of the most difficult I've ever experienced in my career. Not for the reasons I just described a few minutes ago, but because I am a human being. As a single mother of 3 children during that time, I struggled with the choice to take care of my patients and my employees, or to leave my children at home with a babysitter 14 hours a day, 7 days a week. I struggled because I couldn't give enough time for my family, my friends, or myself. And for years prior to this, I had struggled with anxiety and depression, which was only heightened by the pandemic fallout, and then subsequently watched those closest to me struggle both personally and professionally. Back in the old days, you know, when I walked up the hill both ways with no shoes on, in the snow, you know, we were taught to suck it up. That's how I grew up. Many of us in the 70s did, and that's what you did. We were also taught this as healthcare providers. You just need to suck it up, learn as much as you can during PA school, and then sacrifice everything for the good of patients. Patients always come before yourself. But I will say, after what I learned this past few years, that statement couldn't be further from the truth. And I'm here to tell you that you cannot be the best PA you can be without taking care of yourself first and foremost. We need to start talking honestly and openly about our struggles with mental health as healthcare providers. It is not a sign of weakness, but a sign of strength. And since that time, I have made a commitment to share my story and start focusing on myself and what brings me joy for the good of patients. So it brings me back how I almost didn't make it here today. On my journey to recovery, I accidentally found my joy in competitive cycling. Turns out when you focus on yourself, your well-being, you discover things about yourself that you never thought you could do. Here I was at 43 years old, learning how to ride a road bike for the first time. I just needed an outlet, somewhere and someplace to work out the struggles in my head and relieve some anxiety and depression. This journey to joy has brought me to this past week of competing in one of the largest and most high-profile cycling races in the world. And for the past 8 days, I've been racing with some of the most amazing women, and surprisingly, sit in first place in the overall Omnium event with only 2 more days of racing. And today, I'm missing one of those races, which might take me out of contention. But I feel so strongly about the importance of PAs, and Don will attest to this, leading the future of healthcare, as well as taking care of your own mental health. And I needed to be here with all of you, despite the risk of losing. And as I was driving here and talking with my partner Kevin and thinking about what I was going to talk about, I realized PA school and those many years as a practicing PA were very similar to competitive cycling. First, I had to commit, right? Start with PA school. Second, I had to be vulnerable and open to learning new things I knew nothing about. I had to learn I was going to fail and make mistakes, which was pretty much all of PA school. But just as in cycling, this failure was going to make me a better PA. Next came learning how to race, i.e. clinical practice. Learning how to ride my bike and race along windy, twisty corners, around barriers, uphill, downhill at 25, 30 miles an hour, with anywhere from 20 to 50 women at a time, teaches you some things. Very similar to clinical practice and handling multiple complex patients, barriers, and every crisis that comes your way. Next in racing comes the realization that it's not the strongest who survive, it's the smartest. The ones who race smarter, not harder. The ones who play the game, attack when they need to, or sit in the draft when they need to recover. This is the life of a practicing PA. Finally, next comes winning and enjoying that moment of victory with joy and gratitude, knowing that you did your best, put all the pieces together, and come out on top. I can attest you will feel this with your patients. When you get them to quit smoking, or you find that small cancerous tumor someone missed on a CT scan, or you save a patient's life after an MI, you will win. But the most important lesson of bike racing, or that race called life, is learning how to lose. How to sit with it, how to really feel it, how to take it in, acknowledge it, and accept it. Because you will not catch the cancer in time. You won't be able to get a patient to quit smoking, and you will lose patients. And learning how to accept that, feel that, learn from that, and move on from that will be the key to keeping yourself upright and putting your mental health and well-being front and center. So talk to one another, check in on one another, take care of one another. It is the only way forward as a healthcare provider. You in this room are the future of healthcare, and the future is bright when PAs are at the helm. So today, take in all the feels of that win. New students, be proud of being here today. Getting into PA school is no easy feat. And putting on your white coat today is a rite of passage into this wonderful world of patient care. And new graduates, feel today, take it in. You have so much to look forward to. As a PA, you have a chance to go beyond and change the world. And today, just like that big win in cycling, take a step atop that podium, be grateful, and feel the joy of what you have accomplished through all those difficult twists and turns. You deserve it. Thank you.
Thank you so much for that, Jennifer. One thing I will say, I think she's overplaying the missing the day a little bit. She's 20 points in the lead, and she only loses 20, and all she's got to do is win tomorrow. I mean, I don't know what the biggie is, but anyway, thank you so much for that. And next, I would like to ask the class of 2022 president, Ellie Ecker, to come forward and say a few words.
Greetings to our families, friends, faculty, and my peers. First off, huge shout out to Lucas Martinez, one of our classmates who, of course, for the COVID class, is at home with COVID right now. So big shout out to him. He's graduating with us from the comfort of his own home, but he deserves this. As just said, I'm Ellie Ecker, class president for the class of 2022. I don't know if you guys can recognize me. Does this help? Shout out to Chandler and Johnny, they gave me that joke 2 years ago. So I get to make some remarks on behalf of the class today on our historic day, our graduation. So, hey class, we started school at the worst time. We're so special. You'll never know a class of health professionals better at sanitizing and gloving and masking and PPE and all that good stuff. But most important takeaway from today, well, is that we still did it, and you still did it. Yes, a lot of determination and perseverance is necessary to complete PA school at any time. And yes, we made a lot of mistakes and had some embarrassing moments over the past few years, especially last year. I collected a couple of stories from my classmates. Everyone here answered some questions wrong, of course, but some of us broke a sterile field in an emergency C-section. Don't want to do that. Some of us accidentally set off a fire alarm on the newborn floor of a hospital. And someone accidentally did a DRE more as a DVE. And for some of you non-medical folk, a DRE is a digital rectal exam, so a DVE, I'll let you put that one together. But did we learn? Yes, and hopefully we won't do that again. But it was us who had to be both guinea pigs as well as excelling students at the same time, doing something that was not done before. We were held to the same standards as all of those classes that came before us, and we had to exercise every last ounce of our patience and flexibility, our grit, and we constantly had to prove ourselves to a standard we didn't fully understand because it was all so new. But you did that. And I think in your careers as surgical, dermatology, orthopedic, surgery, hand, plastic specialist, whatever Kate's doing is really cool, and family medicine and internal medicine and emergency medicine PAs, when you face the next communication problem, the next personnel struggle, being inevitably overworked and understaffed, the next pandemic, I hope that you take today the strength and the evidence that you did all of that and succeeded, that you are capable, and that you can do it again. So a lot of thank yous are in order for today as well. First and foremost, the most important thank you goes to our staff responsible for administration, curriculum, and scheduling. With the pandemic, the biggest curveball was thrown at them. The curriculum didn't necessarily change, but the presentation of the curriculum to us was completely dismantled, and they still did it for us, and we still made it here today. So thank you. Thank you to our faculty, our teachers who crafted our medical education and our medical practices. I really don't understand how you do it. I did one round of PA school, and I'm like, oh, I am done. But you guys come back every year and do it, and inflict it on others. And I get a little concerned when I think about it, but then I take a deep breath and I think, just trust the process. And I feel a lot better. Thank you to the clinical staff from year 2, all of our preceptors who taught and trained us, all of our PBL coordinators in year 2 who kept making sure we were alive week to week. I'm sure you're all great. I was in Mattoon. Gary Hayden is the best. That's all I wanted to say. Thank you to our support systems, our families and friends who are here today. I think I speak for many of us when I say thank you for being there for the past 2 years, and also I'm sorry for being physically absent and emotionally labile for the past 2 years. Without having your phone calls to rant to or just remind us there's life outside of medicine, we would not have made it this far, so thank you. And also a huge shout out to the Lincoln Scholars who were in classes with us. They're going to become amazing physicians in the future, and they were right there with us in the trenches and helped us along. I wanted to give some love to the class of 2024. I know you guys don't believe me, and 3 weeks from now, you really won't believe me, but you'll get here too. And my advice is to take breaks, friend breaks, crying breaks count, workout breaks, all kinds of things. Recoup, relax, fill your bucket back up, and then put in a lot of work and get a lot of work out of your PBL. It'll surprise you how in clinical year you'll start being like, I remember that from group, or how you start identifying your friends as diseases in a nice way, but it is very interesting. So finally, every one of us here in the past 2 years has had our doubts, has felt uneasy, has felt very unsure of the future, but I'm here to tell you, congratulations, class of 2022. In the words of Elle Woods, JD, we did it.
Thanks, Ellie. That was great. And now we are going to present the long white coats and the certificates of completion to the class of 2022. So if our fearless leader, Dr. Janet Albers, the chair of Family and Community Medicine, will take her place on the side of the stage. Dr. Smith, can you come forward and read the names, please? And I'll see if I can do as little damage with the coats as I can.
Nicole Beavers. Chandler Boyd. Sean Brandt. Marianne Katrine. Carly Chandler. Alicia Coletta. Caitlin Coltharp. Kaylee Evasic. Lucas Hackman. Cassandra Heron. Haley Hinch. John Holbrook. Amanda Hollab. Haley Inman. Deeksha Jain. Kaylee Jarrett. Luca Ewell. Craig Kozak. Cade Kress. Miriam Lockdeer. Ashton Lee. Sabrina Minesian. Kenneth Padilla. Hannah Palmer. Sophia Quintana. Kelsey Ritzloff. Lily Robinson. Madison Rybach. Sadie Sawyer. Samantha Stats. Elizabeth Sternberg. Amanda Thady. Mackenzie Thompson. Mackenzie Tonks. Elizabeth Eaker. Hannah Vandenberg. Abigail Webster.
Let's give a round of applause to the world's newest PAs right there. They have worked so hard, so proud of them, especially the way that we had to start out when they started. They overcame a lot. All right, Now it is time for the presentation of the short white coats to the class of 2024. Katie Scott, can you come up and read the names, please?
Rukhsar Ahmed. Abby Ballman. Nicholas Brigham. Cameron Browning. Olivia Clausius. Elise Dewey. Elizabeth Eubanks. Lauren Ferguson. Jordan Gentry. Jalen Gunn. Hannah Hutchison. Claire Kuhlman. Eleanor Kuhlman. Megan Lanter. Ellie McCool. Sydney Matusik. Mabry McAllister. Braylon McClure. Sarah McIntyre. Alexander Mikulak. Lexi Mills. Alec Neitzel, Nicole Ostashevsky, Hannah Fenisel, Matthew Pott, Sophia Press, Dalton Ray, Kaylee Scott, Jacob Scholl, Kara Spence, Savannah Staley, Caitlin Taylor, Tracy Thompson, Julianne Wheelock, Allie Whittington, Melissa Worley, Madison Worthington, Emily Ziegler,
So the next part of our ceremony is the awards portion of the ceremony. And the first award is induction into the Pi Alpha Honor Society. Pi Alpha is the National Physician Assistant Honor Society, organized for the promotion and recognition of both PA students and graduates. Membership signifies the inductees' significant academic achievement and honors them for their leadership, research, community, professional service, and other related activities. The Society also encourages a high standard of character and conduct among students and graduates. Following induction into Pi Alpha, students, faculty, alumni, and honorary members may wear the Honor Society membership pin and honor cord at appropriate events. I wanted to say something about this Pi Alpha. They only allow you 15% of the class, and I would be confident that all 38 of these students meet the criteria to be in Pi Alpha. There's just, they only allow that many, but I'm super proud of them all, and they all deserve it. But we're going to announce who is in Pi Alpha. I'm going to have to talk a little louder because I don't want to be jumping back and forth from here to here. So, are y'all ready? We'll find out who this is. All right. First Pi Alpha inductee from the class is Mariana Katrina. Our next Pi Alpha National Honor Society inductee is Cassandra Heron. Next inductee is Deeksha Jain. Next new member is Sophia Quintana. Next new member, Elizabeth Sternberg. Next new member, Elizabeth Ecker. And our honorary member for the year is Mary Nash Swing. Okay, our next awards are for the Preceptors of the Year. I just wanted to say a word about our Preceptors. This could not happen without them. This is a group of people who give their time freely in order to give back, and you just can't do medical training without that group of people. They are the most important. They really are acting out and showing by their actions that they do believe that medical skill is not a possession to be owned, but a gift to be passed on to those who follow, like we said in the beginning, and I much appreciate it. Couldn't be done without them. Yeah. Each group of students, there's small groups that get sent out to what we call different hub sites, geographical regions where they attend their training, and those groups of students vote on their preceptor of the year, and they're very busy clinicians, and some could not make it today, but we do have some in attendance. I'm going to call out all the names, but first I'm going to try to call out the ones that confirmed that they're going to be here. And from our Decatur website, Chrissy Albers. From our Carbondale hub site, Alicia Markley. From the Mattoon hub site, Melvin Fleming. From the Champaign hub site, Aubrey Hudson. From the Cape Girardeau hub site, Anthony McFerrin. From the Belleville hub site, Madison Perez. From the Peoria hub site, Tony Sue. From the Quincy hub site, Hallie Anderson. From the Springfield hub site, Nate Gregoire. Again, thank you to the preceptors. Our next award is given for the most improved standardized test score from the end of year 1 to the end of year 2. We named this award after our dear Charmaine Porter, who we love very much and lost a few years ago. And the winner of the award is Lucas Martinez, who couldn't be here today, but he's watching us on TV. Hey, Lucas. There you go. Okay. Next are our faculty and staff awards. And we use problem-based learning in our program for the delivery of the majority of our curriculum. It's a great, great way to learn. And our students vote on the problem-based learning facilitator of the year. And the winner for this year voted on by the students goes to Jolie Deemer. Jolie's not here today. This is her second year in a row winning, and we didn't present this award here last year, so she's got it twice and never got it presented once. But okay. And our PA program staff member of the year is Paula McNeil. Our dear Paula is also not here today. She couldn't make it for family emergency. So we wish her the best, and I'm sure we'll be seeing her soon. But what a great staff member! All right. What's the last thing? Okay, so it's time to recite the oath. The graduates and the students will be reciting the PA oath. If there are any other PAs or other health care professionals who would like to recite the oath with us, please also stand and raise your right hand and repeat after me. I pledge to perform the following duties with honesty and dedication.
I pledge to perform the following duties with honesty and dedication.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings.
I will uphold the tenets of autonomy, beneficence, non-maleficence, and justice.
I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice.
I will recognize and promote the value of diversity.
I will recognize and promote the value of diversity.
I will treat equally all persons who seek my care.
I will treat equally all persons who seek my care.
I will hold in confidence the information shared in the course of practicing medicine.
I will hold in confidence the information shared in the course of practicing medicine.
I will assess my personal capabilities and limitations, striving always to improve my medical practice.
I will assess my personal capabilities and limitations, striving always to improve my medical practice.
I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine.
I will work with other members of the healthcare team to provide compassionate and effective care of patients.
I will work with other members of the healthcare team to provide compassionate and effective care of patients.
I will use my knowledge and experience to contribute to an improved community.
I will use my knowledge and experience to contribute to an improved community.
I will respect my professional relationship with the physician.
I will respect my professional relationship with the physician.
I will share and expand knowledge within the profession.
I will share and expand knowledge within the profession.
These duties are pledged with sincerity and upon my honor.
These duties are pledged with sincerity and upon my honor.
This concludes our ceremony today. I would invite everyone to go to the International Lounge if you would like to see the research projects of the class of 2022 are up in there, and they're really fantastic if you'd like to take a look at those. But or if you just want to hang out, because we're going to need to move out of this room, not just right away, but super quick, because they have to turn it over for our next graduation, which is our first class of doctoral PAs that are going to be graduating. So thank you so much for coming. Thank you for the support. that you give to your loved ones. I appreciate it.
Hand you. You gotta be at the microphone.
I know.
I was gonna hand them to you.
I should have done.